Hello everybody, did you know that September is Gynecological Awareness Month, and we felt it would be really good to talk to somebody who has a greater understanding than I do, which is very easy. And so in the house today, and welcome, we have Dr Brooke Vandermolen. Lovely, we were thinking Dutch origination name before we met you. And Dr Brooke, you work as an obs and gynae at University College Hospital.
Yeah.
So I felt that's a fantastic person that Poppy has found who does our research on the lives. And I'm going to start with a really question. You might think I sound very stupid, but I don't particularly know the difference between ovarian and cervical cancer. And I just don't know how. I lost that education, but I don't have it. So can we just start with that?
It's not a silly question. There's no such thing as a silly question, because actually we aren't educated enough about women's health, all of the different organs, all the different cancers. So I think it's so important, and I'm so grateful that you have me here to talk about these things today.
Us too.
So, first of all, the question is the difference between cervical cancer and ovarian cancer. Well, your cervix and your ovaries are both parts of your gynecological organs, but they are separate. So you can get cervical cancer and you can get ovarian cancer. So your cervix is the neck of the womb. So we often talk about the cervix, for example, when you're pregnant, and that's the bit that the baby comes out through. So it's kind of the exit of your womb. Whereas your ovaries is what contains your eggs. They're connected to your fallopian tubes, which are connected to your uterus. So in a separate location to your cervix. And I think the important reason we should make that distinction is because if you get cervical cancer, we can pick that up with a smear test, because that we pop the smear test in through the vagina and touch the cervix, but we can't touch your ovaries. So you can't take a smear test of the ovaries. Okay, so the not penetration, what's the word? When you find out it's there, the diagnosis. The diagnosis is much easier with cervical if you're having a smear test every year. So a smear test is a way, it's like a screening test. It's a way we can check everybody in the population. Every woman has regular smear tests. So we can pick up that cancer if it's developing at a very early stage, or even better, pick it up before it becomes cancer.
When you have those little cells that are turning.
Exactly. We don't have a screening test for ovarian cancer. We can't just test everybody in the population. Everyone pops along to their doctor and has a blood test, or has, just one particular test that we can pick up ovarian cancer.
So tell me then, because people watching, we have a lovely audience, and I would say as a group we're sort of predominantly sort of 35 plus, but is it more prevalent in different age groups? That's one thing I want to ask. And how then do people find out if they might be more at risk to gynecological cancer?
So there are certain people that are more at risk of ovarian cancer particularly. So one you've already mentioned, age. So the vast majority, so over 80% of ovarian cancers are found in women who are over the age of 50.
I didn't know that.
But it's actually commonest between the ages of about 70 and 80.
Oh, I didn't know that either.
Yeah.
Okay, did you know that? I just want to know if that's really interesting. Is that because they can go detected so long?
No, it's more that it arises, and the thing about ovarian cancer is once it starts developing, it can develop quite quickly. But we just noticed that it happens more in that age group. So age is a risk factor, but also family history is really important. And that's family history so if anyone in your family has had ovarian cancer, but also if your family have had breast cancers. And there are genetic conditions that you might not even realise, but a number of people in your family have had breast cancers, ovarian cancers, colon cancers. And when you put that all together, you realise you're more at risk of ovarian cancer. So I'm here kind of as an ambassador for Ovarian Cancer Action, and they've got an amazing tool on their website. You can put in your family history, you can put in some details about you, and they can tell you if you might be more at risk of a hereditary form of ovarian cancer.
That's brilliant. And we are going to list, when we post this, we will list a link to Ovarian Cancer Now, because they have done a fantastic landing page for this live to answer lots of questions and to do the link to what you're saying. So how then, what kind of symptoms could we have that might make us feel we should go and see our gynecologist? So
literally the best thing you can do, the best way that you can pick up ovarian cancer is to be aware of your body and to look out for the symptoms. So the symptoms are pain, although that's not such a big feature with ovarian cancer.
But pain in where you would have your period.
Yes, exactly.
Because a lot of these women might be postmenopausal, so they're not used to pain there.
Pain, exactly. Bloating is a big one.
Really, but then half the women watching will say, I bloat.
Yeah. Feeling full. So again, quite a vague system, feeling like you've either lost your appetite or you just feel full and you don't really want to eat.
Yeah.
Or that you need to pass urine a lot more than you did before. Again, these are all vague symptoms. It's
They're
just
vague
not ideal.
because I could answer yes to all of them.
Yeah.
I just have to say, because
Yeah.
I do feel bloated.
Yeah.
I do feel that I don't feel so hungry.
Yeah.
You know, and yeah, so yeah, but then I don't know, my family, my mother had breast cancer. But, you know, it's like, so if you feel that those 4 you definitely say yes to, do you think then you should be taking positive action?
Yes, so what we're thinking about here is, you know, you might have been bloated all your life. You might feel that after I eat certain foods, you might have IBS. So that doesn't mean that you've got ovarian cancer. These symptoms are common, don't mean everybody's got ovarian cancer. What we're saying is there a sudden change? If you think back, those, you know, about a month or 2 ago, you didn't really need to pee a lot, you didn't need to run to the bathroom, but suddenly you're finding that is a new symptom.
Yeah.
That is concerning if it's developed over the last few months, or you just think something's not right in my body.
It's a sudden change that you're noticing.
Exactly.
All right.
And then you definitely see your doctor. So usually your first port of call is your GP. If you've got a gynecologist, then go to a gynecologist. But GP, you should just go and say, I've noticed these new symptoms, and say the words, I'm worried I could have ovarian cancer. Yeah. They will sit up and listen, and sometimes they might reassure you, but they might take it seriously and take the next steps. But if you take those steps to go and see your doctor, that's the most important part.
Can I ask you something? And this is I don't want to ask you because you are a part of the medical profession who I respect tremendously. But do you think a few GPs, because of the pressure that everybody's under, they maybe, unless somebody comes in saying, I feel I've read up on it, I've got these 4 things that are mentioned, please can I have an ultrasound?
Yeah.
But do you think some people are missed?
Definitely. That's the sad thing. First of all, we don't recognise it in ourselves, or we might reassure each other. You know, your friend might say, oh, I think I've been feeling a bit bloated, and you say, don't worry, it's nothing. So they don't take that step to see the doctor, or the doctor doesn't really have ovarian cancer at the forefront of their mind either, and they may not investigate it further. So we have to understand our bodies and advocate for ourselves, unfortunately, until there's a better test. We want there to be a better test for ovarian cancer. That's why I think Ovarian Cancer Action is funding a lot of research. They have made steps. They're funding a group in Oxford, actually, at Oxford University, and they have made positive steps that they think will be a foundation of a screening test in the future.
So now how do you then, so if you say I've got these symptoms and you're feeling uncomfortable, you've had these changes, would a good doctor say, you're going to go to a gynecologist and they will do how do you do it? You do an ultrasound?
Really good question. So the next steps, once you see your doctor, they'll examine you usually. And then the next steps will be, they'll probably arrange some blood tests. There are certain blood tests we can do to help us identify ovarian cancers. And then, importantly, they will do an ultrasound scan, exactly as you mentioned. That should be done urgently. If you go to somebody saying, I think I've got signs of ovarian cancer, they should be arranging that scan within 2 weeks, so an urgent scan. And then from there, they put all the pieces together. They might discuss it in a meeting. They might arrange more scans. Yeah. And if they do find that it is unfortunately an ovarian cancer, then the next step is usually to work out what stage the cancer is at. So if it has spread anywhere, and if we need to do surgery.
Okay, before we get on to that, just if you're joining us, we are talking about ovarian cancer. It is Ovarian Cancer Month, and I'm here with Dr. Brooke, and she is telling us all about what we can look for in symptoms. But I'm just going to do, because there are a few questions, there's lots of questions actually, and I just think it'd be really good to, you know, Jackie, do have it checked out. I had cancer and I thought I was eating too many cookies. I'm cancer-free now, ladies, take care. I mean, that's such a interesting, just that somebody would say that. I thought I was doing that, because there's a lot of women of this certain age you're talking about, Dr. Brooke, who think, I better not complain. Yeah. You know, there's that whole thing. Jane, great question, Trinny, this is so good. Hard to get docs to listen. Jackie, yes, Jackie was I was told my ovarian cyst was a fat lump. It was 22 to 24 centimetres.
That's very big.
Yeah, that is very big. Tara, my aunt was 50, my mum 60, my cousin 40, and I was 46. All have passed from ovarian cancer, except me. Get out there and be checked if you have symptoms. Thank goodness for high-risk clinics. That's just, you know.
That's it, family cancer. Family history is really important.
Yeah. Don't minimise your concerns at the medical practitioner. Get a second opinion. I do agree with that too. Yeah. Hello, Bay City. I did not, a lot of people don't know. A friend in her 40s passed from ovarian. Testing is important. Chloe, the symptoms we're going over, somebody from the office here, Chloe's watching and asking. Other questions, Poppy?
Yeah, someone's put, I was diagnosed with bowel bowel cancer earlier this year. I'm now cancer-free after surgery, but I'm concerned whether there's a link between bowel cancer and ovarian cancer. And is it safe for me to use HRT?
Yeah, that's a very good question.
Yeah. So I did mention earlier there is a link between bowel cancer, but actually bowel cancer is more common than ovarian cancer. And so the vast majority of bowel cancers aren't hormone related. They aren't necessarily related to ovarian cancer. But there is a small group, and that's why we look at people who, for example, have breast cancer and colon cancer in their family to work out if those people are more at risk. So I really hope you get well soon from your colon cancer, but I wouldn't necessarily worry too much. Again, you should be kind of looking out for any of the symptoms and talk to your doctor about your particular cancer if that one puts you at higher risk. There is a link, but it doesn't mean that you're necessarily much higher risk.
To get it.
HRT though is another thing that was mentioned.
Yes,
there. That's a good one
because HRT, you know, there are many. We've had many conversations here about HRT, and for women who have the majority of breast cancers, you cannot do HRT. There is only one. I think people feel it's when it's non. I can't remember the word, but non something that you can. But is there any element here about HRT that we should be discussing?
So there are certain things that can increase your risk and certain things that decrease your risk. So, for example, you're at higher risk of ovarian cancer if you have had more menstrual cycles in your life. So if you started your periods earlier or you went through a later menopause, that does, we know, increase your risk of ovarian cancer. Taking something like the oral contraceptive pill in your lifetime reduces your risk. Surprising because it does have other effects, but actually when it comes to ovarian cancer, because the oral contraceptive pill stops you from ovulating, it reduces your risk. HRT falls somewhere in the middle. Some people say it slightly increases the risk of ovarian cancer, but actually more recent evidence has said it doesn't have a very strong link. So we worry with HRT about breast cancer, but less so with ovarian cancer.
And there's a lot of research now done in America on just how HRT can reduce inflammation in the body, and if you have a reduction in inflammation in the body, how much better your body's protected generally from cancer. I know that's a really big statement, but I think there's so much research now, whereas 10 years ago it was like you can't take HRT if you have a heart condition, or if you know, there were these kind of things that have now been debunked. So it's interesting where HRT is going in terms of actually reducing the possibility of other illnesses as a result of taking it.
We do know it does have some benefits, and I think that's what's the change that's happened in the last few years is we are less scared of HRT and more encouraging that as long as people are empowered and have all the information, I think it can be a fantastically helpful thing for some people. But it has got risks, but we've got to balance that with how beneficial it can be for certain people. So I think it's really important to have those conversations. There are certain people who shouldn't take HRT because they will be more at risk, for example, of breast cancer. But if it's something that you're thinking about, then we shouldn't be as scared as maybe we were 10 years ago.
I want to ask another question, which is, I think there are some people out there who maybe you might feel, oh, I might have some of the symptoms. And sometimes when we get a sense we might have something, we get then very paralysed and fearful to do anything about it, because we might think, oh, what's an ultrasound like? Is it painful? All these things that you can project in your mind. So can you just take us through, if you feel there's a problem, you do the blood test, you have the ultrasound, which is, if you've ever had any ultrasound, it's like just shoving that thing up. It's not really much. A little bit of gel, you have to wipe it off and that's it. But then what happens after that?
I mean, I know that myself. I think, first of all, we're busy. You notice a symptom in yourself. You're a busy working woman. You're everywhere. And you think, oh, I'm not going to slow down for this. And in the back of your mind, that's probably because you're scared. And you don't really want to face what it could be. But, the truth is, with anything, even more so with ovarian cancer than with anything else, the earlier we diagnose, the earlier we get the information, the better your outcome. Because, yes, it's treatable, but it is much less treatable, or the outcomes are less successful in curing the cancer the later it's diagnosed. So absolutely, no matter what that fear is in the back of your mind or how busy you are, you do need to prioritize yourself. Take that time to make that appointment, make that first call. Usually, once you've got the appointment booked in, you'll probably attend. It's even just the making the phone call.
It is,
and I say the same about the men in your lives. Men are terrible at pushing themselves forward and thinking of a symptom, actually booking an appointment. But it's so important that we do take those steps, because doctors can't help you if you don't go.
You don't show up.
And if you're worried about something in particular, I think people always ask me, I've been avoiding my smear test for years, or I'm really scared, like you say, of the ultrasound, which we might say, oh, it's nothing, but for other people, especially if you have vaginismus, you've had, sexual trauma in the past, anything like that, it can be so triggering and so difficult for you to even engage with that thought that you might have to have that. book the appointment and just discuss those concerns. You don't even need to have the smear. You don't need to have the scan. Book the appointment, tell the doctor or the nurse about what it is you're worried about, and they can tell you what they can put in place to help you. And we have got things that we can do to help to make those things more comfortable.
Yeah.
But take the step.
Yeah. There was, I had when I was much younger, I had ovarian cysts. And I remember I thought I felt something, and I felt up my fanny. And I hadn't actually felt them. I was constipated. Yeah. But I went to my doctor, who then said, oh, you're fussing about nothing. And I kept feeling that. Maybe I was just kept constipated. It was lucky. I went back. And then they finally said, all right, if you demand it. So I went to this very scary man at St. Stephen's, which is an old hospital, is no longer there. And I walked in, and she'd obviously written him this letter saying she's a hypochondriac, really, whatever. Anyway, he said, so you think you have something there? Well, there's no way you could feel anything. Get undressed and we'll have a look. I mean, just like, I felt traumatized by that. Anyway, I then come back out and he's sitting there, and I sense there's a difference. And he goes, yes, there is something there, and you've got an ovarian cyst. And I said, well, I'll come back in a month. And he said, no, I'm going to operate tomorrow because it's the size of a grapefruit. So I had it taken out. But if you've had ovarian cysts that have nothing wrong with them, mine was just a benign cyst, is there a greater chance or not? Or is it nothing to do with it?
So having had a benign cyst like that's been removed, benign cysts are very, very common. We all make cysts every single month. Every time we're ovulating, or in the run up to ovulation, we make lots of follicles.
I didn't realise we make lots of cysts.
When they kind of persist and they stay there, and especially if you become pregnant, you get a corpus luteum cyst. So everyone, when in the early stage of pregnancy, a cyst is actually what maintains your pregnancy. It makes hormones that keeps the pregnancy going. So cysts themselves, very common, very kind of part of how ovaries function, and they can come and go and they disappear the next month. Cysts can grow large. We sometimes operate on them. As long as they're benign, that doesn't necessarily mean that you're at any kind of increased risk, not necessarily. There are things that there is a relation between PCOS and ovarian cancer, and conditions like endometriosis and ovarian cancer. Those two are linked. Yeah. There's nothing you can really do differently if you've got those conditions.
Polycystic ovaries?
Yeah,
does that happen?
PCOS.
Oh, that's polycystic.
Yes. So again, if you've got lots of cysts, so I think we would like to be aware. But it doesn't mean that you necessarily are going to get ovarian cancer, and I don't think anyone should panic as a result of that. Again, endometriosis, very common condition, affects 1 in 7 women. Yeah. Slight link with ovarian cancer, but the most important thing is still to be aware of your body, be aware of those symptoms, and to look out for it.
Yeah, great. You make it so clear, actually. It's very, very helpful. Suzanne replying, Erin Bryant, I had 2 in the past 3 months. It's not that bad, but get sedation if you need it. Trust me, you will wonder why you were so frightened.
They're talking about colposcopy.
They are.
That's for cervix.
Yeah, so cervix. Indeed, Deborah downloaded Dr. Louise Newson's Balance app. There is a lot of information regarding HRT menstrual. She's lovely. We've had her on here, actually. I struggle to understand why I had to have a hysterectomy in case I had cancer from my ovarian cyst.
Okay, that's an interesting question, because it's usually when we're worried about cysts, we're operating on the ovaries. A hysterectomy means removal of the womb. Yeah. Slightly separate, but sometimes, especially if you're postmenopausal, if you've got something affecting one ovary and we don't quite know what it is, we would usually recommend removal of that cyst. And usually once we're removing the cyst, there's no point, you don't need an ovary after you're menopausal, because you're not making any more eggs, you're not making more estrogen. Yeah. So we usually take that ovary away. And then, because you don't need the other ovary either, and the longer it stays there, the more chance it has of getting ovarian cancer. So if we're operating on one ovary, we usually remove both ovaries. Sometimes we would remove the womb as well and remove it in one go. And that would just depend on the type of symptoms that person's getting. Okay. If we do think there is a strong chance someone has cancer in their ovary or their womb, we would recommend it. The womb as well.
All right.
But not always.
Jackie, I hope that's helped a little. Sometimes people go to specialists who maybe they're not brilliant at explaining. And I think the thing that I always suggest to friends of mine when they're diagnosed with anything, and a friend of mine in America went through cancer, and he always found it difficult to absorb all the information at the specialist. I said, have a friend on the phone who knows a bit more than you, or who can record it so that they can feed back to you, because we can also leave an appointment and just hear the worst things and not the reality. And it really helped him to get through, and he actually had a very bad form of leukemia, and he's now through and okay.
Wow, amazing.
But his lack of panic came from this friend of mine, Zandy, who's a scientist who could just interpret for him. Yeah.
There's a question about IVF and if that increases your risk as well.
So
Yeah, interesting, because I've had 16 rounds of IVF.
wow.
Yeah.
Again, what we're thinking here is increasing the risk is about related to how many times you ovulate, and how much we stimulate the ovaries will increase the chances of developing cysts and increasing the number of ovulations. So yes, it can be related, but it's usually for a very focused time in your life. So it's a short-lived period. 16 rounds. Did you say 16 rounds?
Yeah.
That's a lot more than the average. Would be usually about.
I did 9 to have Lila. She has a daughter called Lila too. Isn't that lovely? And then I did 6 after.
Wow. So that is a lot of rounds of IVF.
Yeah.
But I think normally we're talking here about sort of 2-3 rounds of IVF, and that's stimulation of the ovaries. Again, maybe it would be a slight increase, but it's not very significant, because over time, that's over the course of your lifetime, it's not a lot of years of stimulating.
Exactly. I want to ask you something. This is totally a side topic, and I have different views, and I always want to ask experts on this because I get different views. If you've had IVF, one person has said to me that, because my mother went into menopause at 55, but I went in at 45, that I had the equivalent of 10 years of eggs taken out, so I went into menopause earlier.
Yeah.
Do you believe that?
We are born with a finite number of eggs in our life. So when we are, when you're born is when you have the most number of eggs, and you do lose them every single month, and you lose lots more than just one a month, because every month, 10 or 12 will start to develop as follicles, and one will get released. If you start stimulating that process a lot more, yes, you will stimulate the loss of those eggs earlier, so it can reduce your ovarian reserve.
Yeah. Doesn't that make you feel angry when they tell you nothing is wrong? Same happened to me. Different diagnosis than yours. When my PCP kept telling me I was in menopause, I finally found a doctor who diagnosed me with a serious condition, treated it, and now I'm fine. It took 2 years. It is about knowing our body. Yeah. Poppy.
What about fibroids? Is
Cystic fibroids.
Yeah.
So fibroids are a benign growth in the lining of the womb. So we were talking about cysts, benign growth in the lining of benign growths in the ovaries.
Yeah.
Fibroids is in the lining of the womb. They're kind of like the main problem that people get from having fibroids is they get very heavy periods.
Okay.
The fibroids themselves can also impact on miscarriage. More rarely, depends on where they are in the womb. But the main problem people get is heavy bleeding. They're not related to your ovaries.
Okay, great. Debbie, I went into menopause at 30 years old. I never had her now have osteoporosis, and doctors say I can't have hormones now.
So it's a slightly different topic from today, but menopause and osteoporosis are related, because it's the estrogen that we produce that maintains our bones and prevents us from getting...
don't know why they wouldn't let her have HRT.
I'm not sure about that.
I'm not sure about that either, because maybe you have another condition, but HRT I think is, I feel it does help if my mother has osteoporosis, and I do feel it
can help prevent bone loss,
Pops?
Some people are asking the difference between the keyhole surgery and the open surgery as 2 different options.
Yeah.
Okay, very important question, because we do operate lots of different ways. We're really focused on the treatment actually for ovarian cancer. So once you have been diagnosed with ovarian cancer, then usually the first step is usually treatment with surgery, unless it's at a very late stage. But the primary treatment for ovarian cancer is usually removing it and removing the other organs nearby, because you want to reduce the risk that it's spread. It depends exactly where the cancer is at that time. And we can operate in different ways. We can operate what we call laparoscopically, which is keyhole operations, which is when we make little tiny holes, so usually one at the belly button and then 2 or 3 other holes in the tummy, and operate that way, or we do an open operation. We tend to do keyhole operations if we're at a very early stage. So we could do like a laparoscopic hysterectomy, so removing the womb and the ovaries. That way, if the ovaries are quite small, and the cancer we know has been very well contained within the ovary, so it's at stage 1. If it's beyond that, or we're worried about it spreading in the lymph nodes or anywhere else, we would tend to just open. So that would usually be a midline cut down the tummy.
Okay. All right. Well, I hope that gave you lots of good information. Debbie, I think knowing whether you can have HRT now would be something I would go back and ask your doctor, but really question them, and even perhaps go to look at something like Dr. Louise Newson, who has a very good menopause app. And what that does is it allows you to know which questions to ask. So then your doctor, if you don't always see the same doctor perhaps, will feel that you're really knowledgeable about your body, and you know what you want, and see if that's possible.
I say as a doctor, I want people to come to me with their information. I know maybe the old school ones maybe wouldn't, but I like people, if you've read about it and you know your body and you're asking the right questions, then we can have a more informed discussion, and that's great.
Great. wish all doctors were like her. Mary, thanks for reminding me to get my exam. Skipped a lot during pandemic, overdue. It's good. And can I just say, anyone who is due for a smear test and you've had the note and you've had the text on your phone, go and get it done. Different cancer, but go and get it done because it's undetectable unless you have the smear test.
So smear tests don't detect ovarian cancer,
Yeah.
but very important to get those too.
Yes, and I think for knowing symptoms at the beginning of the film, we did discuss those symptoms. And just generally, if you have a gynae, book an appointment. As you said, Dr. Brooke, more susceptible in women post-menopause. So really good for a number of women watching.
Could I just ask finally, any
yes.
common myths that you think are worth debunking live? Anything that a lot of things that you get patients coming in and saying, is this true? Things that you want to put straight. Any common misconceptions at all?
I think one of the commonest misconceptions is that young people can't get it, and I know we're focusing.
But lots of people here have,
but a lot of people
are
assume,
younger
or have children,
Yeah.
and unfortunately, we do hear a lot of young women being diagnosed also with ovarian cancer, with breast cancer, with cervical cancer, but ovarian cancer. About 20% of people who get ovarian cancer will be under the age of 50 as well.
Yeah.
So that is a fifth of all the people. It's the 6th commonest cancer in women, and so it includes all women of every age.
Yeah.
Also, young girls can get ovarian cancer because there are certain types, different type of ovarian cancer. There are, they're called the germ cell tumours, but there are types of ovarian cancer that actually affect young girls. So it's not just older people, it's basically of any age, so everyone just needs to be aware of these symptoms.
And I imagine the worst case scenario is you are younger, you don't catch it soon enough, and you have to have a hysterectomy.
Your ovaries would have to be removed, so that is
which you
very important.
want to avoid,
Yeah.
if you can. All right. Hope that was informative for you. Thank you so much for coming on and telling us more. And if you've just been watching, then there's more information, as I mentioned halfway through, we'll put a link in and it will go to the Gynecological Cancer Awareness site. It is Ovarian Cancer Action. And they have done a whole landing page for us with lots of information on it and ways that you can do the tests that Dr. Brooke spoke about, etc. All right. Thank you so much for tuning in.
Thank you for having me.
Thank you.